Good afternoon. The case study that I have chosen follows a 67-year-old female with dementia who made an advanced care directive after the passing of her husband years ago. She has since had the dementia diagnosis. She is now living in a nursing home and has different memories and medical preferences about her life. She has a new partner, and as her dementia has progressed, she has developed new preferences. She was recently admitted to the hospital for a broken hip, and upon admission, she states, "I want to live life. I love my life. I'm so happy now, and I would like you to do everything possible in intervention." The ethical dilemma arises from the written legal paperwork she had prepared before her dementia diagnosis, or the patient's expressed wishes in her current state. Although guided by this ethical provision from the American Nurses Association to practice compassion and respect for her inherent dignity, worth, and unique attributes of every person, I would qualify that her expressed wishes qualify her for compassionate treatment overriding any previous paperwork. To make this beneficial and an ethical decision, some factors that the healthcare team must consider. Does this patient have a medical power of attorney? Or have they had a medical state-appointed healthcare representative? What is the state law or hospital policy regarding this situation? Is there an ethics board that can meet with the representatives in this decision to form a collaborative solution? And what are current laws guiding this practice? From these questions, I think several goals can be formulated. There should be collaboration with the hospital ethics committee to make a decision including the expressed wishes of the patient and if there is a healthcare representative. State law should be consulted. Specifically, if this situation were to occur in Texas, we are guided by laws on advanced directives. Texas state law is Safety Code Section 166.037, stating the patient desire supersedes directive states. Quote, "The desire of a qualified patient, including a qualified patient younger than 18 years of age, supersedes the effect of a directive." End quote. A complete physical examination, lab results, and psychological examination with specific assessment of capacity for decision-making should be conducted. Once these assessments have been completed, I believe there will be more clarity on the right decision for this case study. Once all of the information is provided, I foresee multiple decision options for this patient. First, following the stated desires of the patient and doing every intervention possible. Second, concluding that this patient is not qualified per the assessments to make decisions in the medical capacity and following the care listed as the advanced directive. Third, concluding that this patient is not qualified to make medical decisions and making medical decisions from a power of attorney or state-sanctioned medical representative. Each of these potential decisions bring about significant positive and negative impacts. Because the patient has a diagnosis of dementia, the legal and compassionate ramifications of allowing every intervention of that patient might not be fully understandable or a litigation possible for the patient to understand. Some interventions, such as chest compressions and intubation, are measures that are crucial to deteriorating patients. But they also can come with side effects of broken ribs and potential inability to breathe on their own. On the other hand, failing to follow the patient's wishes as they communicate their desire to live makes the healthcare team liable to legal action and neglectful of the patient. A key component of this decision is understanding the patient's capacity to make decisions, and patients with dementia are still in some stages where they can maintain capacity. Key components of capacity management are whether the patient can understand the information relevant to the decision, retain it long enough to make the decision, and weigh upon available information to make the decision, and then communicate their decision by any possible means. In this patient's case, I would perform every intervention possible based on the information known at this time, until further assessment and/or collaboration can be formed with medical representatives or power of attorney. from this patient's stated preferences and desires of loving her life, wishing to continue living, and the desire to have every intervention possible. Within the ethical responsibilities of my role, every patient deserves to be an advocate for themselves and have their goals and desires respected.